This skill is designed to evaluate your ability to provide immediate and aggressive ventilatory assistance to an apneic adult patient who has no other associated injuries. This is a non-trauma situation and cervical precautions are not necessary. You're required to demonstrate all procedures you would perform, from simple maneuvers, suctioning, adjuncts, and ventilation with the BVM. You must actually ventilate the mannequin for at least 1 minute with each adjunct and procedure utilized. I will serve as your trained assistant and will be interacting with you throughout this skill. I will correctly carry out your orders upon your direction. Do you have any questions?
I do not.
At this time, please take 2 minutes to check your equipment and prepare whatever you feel is necessary.
Okay.
Upon your arrival to the scene, you find a patient lying motionless on the floor. Bystanders tell you that the patient suddenly became unresponsive. The scene is safe and no hemorrhage or other immediate problem is found. You have 5 minutes to complete this skill.
BSI, is my scene safe?
Your scene is safe.
Sir, can you hear me? I'm going to go ahead and request an additional ALS. I am going to check for breathing and a pulse simultaneously for no more than 10 seconds.
The patient is unresponsive, apneic, and has a weak pulse of 60.
I am going to perform a head tilt chin lift to open the airway.
The mouth is full of secretions and vomit.
I am going to prepare my suction unit. I'll turn the suction unit on. I will advance the suction device without applying suction. And then without going beyond my field of vision, I will suction the mouth and the oropharynx.
The mouth and oropharynx are now clear.
I'm going to again make sure that the airway is open. I'm going to measure for an OPA from the edge of the ear to the corner of the mouth and insert the OPA.
No gag reflex is present and the patient accepts the airway adjunct.
I'm going to assist ventilations with a BVM at a rate of 10 to 12 breaths per minute or 1 breath every 5 to 6 seconds.
Ventilation is being properly performed without difficulty.
I am going to recheck for a pulse. And at this time, I'm going to go ahead and attach my BVM to 15 liters of oxygen and continue to ventilate.
How would you know if you are delivering appropriate volumes with each ventilation?
I would watch for equal and adequate chest rise and fall. I can look for improvements in oxygenation, improvements in skin color and condition, and I can also monitor capnography. And this is the end of my scenario.